to our YouTube channel.
Due to the pandemic that is currently affecting the world heavily, we were unable to keep up with our regularly scheduled uploads. With this video will be our last video about eating disorders, but if you haven't already, go check out our last video linked down below.
Today, we are going to cover some more causes, the effects of eating disorders, and how to seek help. Genetics, biology, psychological, and emotional health are all general causes of eating disorders, but there are also some other risk factors.
Certain factors may increase the risk of developing an eating disorder, including family history. Eating disorders are significantly more likely to occur in people who have parents or siblings who have had an eating disorder.
Other mental health disorders are also important to consider because people with an eating disorder often have a history of anxiety disorder, depression, or obsessive-compulsive disorder.
Dieting and starvation is exceptionally relevant. Dieting is a risk factor for developing an eating disorder. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite.
There is strong evidence that many of the symptoms of an eating disorder are actually symptoms of starvation. Starvation and weight loss may change the way the brain works in vulnerable individuals, which may perpetuate restrictive eating behaviors and make it difficult to return to normal eating habits.
The last factor we are considering is stress. Whether it's heading off to college, moving, landing a new job, or a family or relationship issue, change can bring stress, which may increase your risk of an eating disorder.
With these risks, there are also complications. Eating disorders cause a wide variety of complications, some of them life-threatening. The more severe or long-lasting the eating disorder, the more likely you are to experience serious complications such as
serious health problems, depression and anxiety, suicidal thoughts or behavior, problems with growth and development, social and relationship problems, substance use disorders, work and social issues, and possibly even death.
Although there's no way to prevent eating disorders, here are some strategies to help your child develop healthy eating behaviors.
Avoid dieting around your child. Family dining habits may influence the relationships children develop with food. Eating meals together gives you an opportunity to teach your child about the pitfalls of dieting and encourages eating a balanced diet in reasonable portions.
talk to your child. For example, there are numerous websites that promote dangerous ideas such as viewing anorexia as a lifestyle choice rather than an eating disorder. It's crucial to correct any misperceptions like this and to talk to your child about the risks of unhealthy eating choices.
Cultivate and reinforce a healthy body image in your child, whatever his or her shape or size. Talk to your child about self-image and offer reassurance that body shapes can vary. Avoid criticizing your own body in front of your child.
Messages of acceptance and respect can help build healthy self-esteem and resilience that will carry children through the rocky periods of the teen years. Finally, enlist the help of your child's doctor. At well-child visits, doctors may be able to identify early indicators of an eating disorder.
They can ask children questions about their eating habits and satisfaction with their appearance during routine medical appointments, for instance. These visits should include checks of height and weight percentiles and body mass index, which can alert you and your child's doctor to any significant changes.
If you notice a family member or friend who seems to show signs of an eating disorder, consider talking to that person about your concern for his or her well-being. Although you may not be able to prevent an eating disorder from developing, reaching out with compassion may encourage the person to seek treatment.
So when should you see a doctor? An eating disorder can be difficult to manage or overcome by yourself. Eating disorders can virtually take over your life. If you're experiencing any of these problems, or if you think you may have an eating disorder, seek medical help.
Unfortunately, many people with eating disorders may not think they need treatment. If you're worried about a loved one, urge him or her to talk to a doctor. Even if your loved one isn't ready to acknowledge having an issue with food, you can open the door by expressing concern and a desire to listen.
Be alert for eating patterns and beliefs that may signal unhealthy behavior, as well as peer pressure that may trigger eating disorders. Red flags that may indicate an eating disorder include
skipping meals or making excuses for not eating, adopting an overly restrictive vegetarian diet, excessive focus on healthy eating, making own meals rather than eating what the family eats, withdrawing from normal social activities, and persistent worry or complaining about being fat or of talking of losing weight.
There is also frequent checking in the mirror for perceived flaws, repeatedly eating large amounts of sweets or high-fat foods, use of dietary supplements, laxatives, or herbal products for weight loss, excessive exercise, and calluses on the knuckles from inducing vomiting.
Additionally, there are also problems with loss of tooth enamel that may be a sign of repeated vomiting, leaving during meals to use the toilet, eating much more food in a meal or snack than is considered normal, expressing depression, disgust, shame, or guilt about eating habits, and even eating in secret.
If you're worried that your child may have an eating disorder, contact his or her doctor to discuss your concerns. If needed, you can get a referral to a qualified mental health professional with expertise in eating disorders, or if your insurance permits it, contact an expert directly.
If you are ready to schedule an appointment, here's what you might expect from your doctor and a mental health professional. But before that, you may want to ask a family member or friend to come with you. Someone who accompanies you may remember something that you missed or forgot. A family member may also be able to give your doctor a fuller picture of your home life.
Before your appointment, make a list of any symptoms you're experiencing, including any that may seem unrelated to the reason for your appointment, and key personal information, including any major stresses or recent life changes.
Additionally, make note of all medications, vitamins, or other supplements that you're taking, and their doses and questions to ask your doctor so that you'll remember to cover everything you wanted to.
It's difficult to cope with an eating disorder when you're hit with mixed messages by the media, culture, and perhaps your own family or friends. Whether you or your loved one has an eating disorder, ask your doctor or mental health professional for advice on coping and emotional support.
Learning effective coping strategies and getting the support you need from family and friends are vital to successful treatment.
Some complementary treatments and approaches may help reduce stress and anxiety, promote relaxation, and increase a sense of well-being in people with eating disorders. Examples include acupuncture, massages, yoga, and meditation.
To improve your chances of success in overcoming your eating disorder, try to make these steps a part of your daily routine. Stick to your treatment plan, don't skip therapy sessions, and try not to stray from meal plans. Follow your doctor's recommendations on physical activity and exercise.
Talk to your doctor about appropriate vitamin and mineral supplements. If you're not eating well, chances are your body isn't getting all of the nutrients it needs, such as vitamin D or iron. However, getting most of your vitamins and minerals from food is typically recommended.
Resist urges to weigh yourself or check yourself in the mirror frequently. This may simply fuel your drive to maintain unhealthy habits.
Don't isolate yourself from caring family members and friends who want to see you get healthy and have your best interests at heart.
If you want extra support, there's also family-based therapy, FBT. FBT is an evidence-based treatment for children and teenagers with eating disorders. The family is involved in making sure that the child or other family members follow healthy eating patterns and maintain a healthy weight.
Cognitive behavioral therapy, CBT, is also an option. CBT is commonly used in eating disorder treatment, especially for bulimia and binge eating disorder. You learn how to monitor and improve your eating habits and your moods, develop problem-solving skills, and explore healthy ways to cope with stressful situations.
No matter how you perceive you or somebody else's body, please remember that trying to have the perfect figure is truly unattainable. Every one of us is perfect in our own ways, and even though that may sound cliche, we should not be ashamed of who we are.
Thank you for following us through this journey of talking about mental health. Please keep your loved ones close and make sure to love your own body. Don't be afraid to speak up about any issues you are dealing with, even if it may be minor from your view.
If you want to learn more about eating disorders and what it is on the more fundamental level, we will have more statistics and websites linked in a blog post on our website.
Please remember that we are not professionals, and if you are dealing with an eating disorder or any other mental illness, please seek an adult or physician to confide in.
You can also call the suicide hotline at 1-800-273-8255. Don't be afraid to speak up.